But most importantly, how does the oral contraceptive work? Now, the oral contraceptive, if taken regularly in a proper fashion, as directed by the doctor or as directed by the pharmaceutical companies in the literature provided with the oral contraceptive pills, it prevents release of egg. It causes some sort of a suppression of a pituitary hormone, which is known as gonadotrophins. And this surge of gonadotrophin, a particular gonadotrophin, LH, is responsible for a release of egg or ovulation. So, if you take oral contraceptives regularly, this LH surge or this rise, the mid cycle rise of the gonadotrophin LH does not happen. And if it does not happen, in that case, eggs are not released. Also, it causes the mucus inside the lower part of the womb very thick and makes the sperm impenetrable. So, one, which is an absolute success if the egg is not released. If there is no egg released, how can a sperm fertilize any egg? And how can fertilization happen? So the baby won't be formed. Even if the egg is released, because the mucus in the lower part of the womb is so thick, impenetrable to the sperms won't be able to reach the egg in the fallopian tube. One day I will talk about how fertilization happens. So this is the way in which the oral contraceptive works. It normally 100%, almost 100% prevents fertilization by preventing ovulation, that is, by preventing the release of egg. Yes, you can start oral contraceptive pills by buying it from the market and reading the literature provided with it, but it's better to have a consultation with a gynecologist or any doctor, the physician you have, and to start and to know how to start and how to continue that. Now, this is the best thing to prevent a pregnancy, an unwanted pregnancy, oral contraceptive pill. There is another thing which is called emergency contraception. You were not taking any contraceptive, you had an unprotected intercourse, and you think you may become pregnant. Once fertilization occurs, the sperm fertilizes the egg, penetrates the egg, and starts forming a baby. This usually happens in the fallopian tube. And after 4-5 days, this fertilized egg comes to the womb and gets implanted within 9 to 10 days. So before the fertilized egg comes to the womb starts preparing itself to accept this a pregnancy. Now, if you alter that preparation, the lining of the womb, in such a way that it cannot accept that fertilized egg, in that case, pregnancy may not happen. The fertilized egg will not be able to embed in the wall of the womb and may get ejected. This is how the emergency contraceptive pill happens. It works. Now, so you know here that oral contraceptive pills, which were taking monthly, regularly, prevents fertilization. But emergency contraception, which you have to take within first 72 hours, earliest possible after an unprotected intercourse, cannot prevent pregnancy, but it prevents the pregnant thing, the embryo, to get embedded in the womb. It's a sort of a abortion pill. So this has a much higher failure rate. Even 5 to 10% cases, this emergency contraception pill can fail. And moreover, these emergency contraception pills have so much of concentrated hormones in it that it is harmful for the mother's body. So if you take regularly emergency contraception pill, your periods may become haywire, irregular, and it can cause an harm to your liver and other organs by this high hormone level. Moreover, most importantly, it may fail. So rather, if you have regular intercourse, a regular partner, use oral contraceptive pill. I will talk about oral contraceptive pill, how to take it one day again in one of the videos. If you like this video, please like it and subscribe my channel. It would be a delight for me. Bye.